So, good morning, everyone. Today's our topic of discussion is drugs for peptic ulcer. So, this is the topic mainly it is important for first year also and in for second year also. For first year there is only physiology of peptic ulcer, and second year there are drugs for peptic ulcer. So, we are going to learn both of this because without knowing the physiology we cannot understand the drugs. Okay, so let us start. Let us start. The topic name is drugs for peptic ulcer. So basically, we have to know that what is meant by peptic ulcer. To know its treatment, to know its drug, we have to know what is actually a peptic ulcer. So first of all, we will see peptic ulcer is nothing but damage to the mucosa and the deeper tissue exposed to acid and pepsin. It is called as peptic ulcer. In some books, it is also given a definition as discontinuity of epithelium of stomach. This is also the correct definition, but this definition which I have given is as per Shanbag of second year. So, so as we have seen the definition of peptic ulcer, we will go forward. So the next point is pathophysiology of peptic ulcer. So here I have represented it in a very good manner. It is very useful to get you marks in your exams. So drugs for peptic ulcer may come for 5 marks. It is a highly important chapter in second year. In second year also, so it may come as 5 marks question or it may come as a short note. Okay, so you have to prepare it well. So first, if you represent like I am representing, then you will get full marks. So now we will see the causes of peptic ulcer. So there are mainly three causes. The first cause is hypersecretion of HCl. As we all know, we are seeing the pathophysiology, so we are seeing the causes. The first cause is hypersecretion of HCl. The HCl is secreted by the parietal cell. The second cause is decreased mucosal barrier or decreased mucosal defense. And the third cause is Helicobacter pylori. As scientists say, the main cause is Helicobacter pylori infection. So we will see the causes of peptic ulcer in detail. The first of all, the hypersecretion of HCl is due to mainly three causes. The first cause is acetylcholine secretion. So acetylcholine, which here we will see acetylcholine. Acetylcholine acts on M3 receptor, that is muscarinic receptor. As we have seen, there are mainly 5 types of muscarinic receptor: M1, M2, M3, M4, and M5. So here is M3 receptor present in the stomach, as we have seen there, and M3 receptor acts on gland to increase their secretion. So here acetylcholine will act on M3 receptor. So the histamine act on H2 receptor. As we all know, histamine, we have seen in chapter 2, histamine has three: H1 receptor, H2 receptor, and H3 receptor. So histamine act on here H2 receptor, which are present in the stomach, and it will increase the HCl secretion. So the next is gastrin. What is gastrin? As we all know, gastrin is a hormone which is secreted into blood. So gastrin increases the HCl secretion by acting on CCK2 receptor, which are present on the stomach wall. So if this is the stomach, so if this is the parietal cell, so this is the lumen of stomach, and this is the blood vessel. This is called as luminal surface, and this is called as basolateral surface. So gastrin is present here. So G cells are present. G cells secrete gastrin, which go into blood, and then they increase the HCl secretion in stomach. So the next cause is decreased mucosal defense. So and decreased mucosal defense is due to the chronic use of NSAIDs such as paracetamol. NSAIDs is non-steroidal anti-inflammatory drugs. So sometimes there is another cause of decreased mucosal barrier is chronic stress also. So the next cause is Helicobacter pylori infection. So as of now, scientists accept that this is the major cause of peptic ulcer. So why Helicobacter pylori causes and how Helicobacter pylori causes? So Helicobacter pylori is present in the flora of stomach. So Helicobacter pylori secretes an enzyme called as urease. As we all know, the urea is converted into CO2 plus ammonia, and this is converted by the enzyme urease. So the ammonium ions is secreted, which causes local inflammation, and this causes formation of ulcer in the stomach or duodenum. So these are the main three causes. So if you know causes, we can easily know the drugs, and we can easily understand the drugs. So next part is treatment. So this is all the physiology part, and next part which we will see is the pharmacology part. Next we will see mechanism how the HCl is secreted. So as we have seen, as we are all seeing, this is the stomach, this is the blood vessel, this is the parietal cell, this is the lumen, and that side of the cell which is facing lumen is called as luminal surface, and that side of the parietal cell which is facing the blood vessel is called as basolateral surface. So this is very important. As we have seen, in kidney also there is confusion in the between the students. As we can see in the PCT, there are lining epithelial cell and there is blood vessel. In PCT, this is the epithelial cell in PCT, suppose, and this is the lumen and this is the blood vessel. So this is the basolateral surface and this is the luminal surface. Luminal surface always lines the lumen, and the basolateral surface always faces the blood vessel. This we should understand. This is the basic thing you should know. So let's see the mechanism how it occurs. so first of all, we will see this the parietal cell. There are 3 receptors: histamine receptor, M3 receptor, and CCK2 receptor. And there are particularly gastrin which stimulate the CCK receptor and increase secretion, histamine on H2 receptor and acetylcholine act on M3 receptor. Here again one receptor present that is called EP3 receptor, which is sensitive to prostaglandin, and this decreases the HCl secretion. This is the exception. All these three, gastrin, histamine and M3 increases the HCl secretion, but prostaglandin decreases the HCl secretion. So now we will see the drugs. It left the proton pump. The proton pump is the here we will only see the final step of secretion of HCl. In the proton pump, the HCl is secreted into the lumen and potassium is exchanged for that, and HCl H plus is secreted and it forms and it joins with chlorine to form HCl. So this is the in short mechanism. Now we will see drugs, how drugs act and where drugs bind. So first of all, there are mainly three categories of drugs, four categories: gastric acid secretion inhibitors, gastric acid neutralizers means antacid which we take, and ulcer protectives and anti-Helicobacter pylori drugs, which means antibiotics. So first of all, we will see this is ulcer, and the protection we are seeing here the protection that are ulcer protectives. Ulcer protective does protect the ulcer by forming a barrier. So the ulcer protectives are colloidal bismuth substrate CBS. Next, we will see antacid. Antacid are the gastric acid neutralizers. So there are mainly systemic and non-systemic antacids. So you can see here, sodium bicarbonate is a systemic, sodium citrate is a systemic, and non-systemic there are 4 to 5 non-systemic antacids. So next we will see gastric acid inhibitor. The first H2 receptor antagonist, anticholinergic drugs, as we know, pyrazipine, propanthyline, etc. These are anticholinergic drugs. H2 receptor antagonist, as we know, Famotidine, Ranitidine. These are H2 receptor antagonists. And here proton pump inhibitor, the most important and most effective drug here is proton pump inhibitor, such as Omeprazole. The drugs which end with prazole, prazole, they are called as proton pump inhibitor. Omeprazole, lansoprazole, rabeprazole, isomeprazole, pantoprazole. Pan 40, Pan 40 is a proton pump inhibitor. We take in a daily life. Proglomide is a gastrin inhibitor, which blocks the CCK2 receptor. So this is all. And prostaglandin analogs are also there, misoprolol. So this is all about the drugs. So if you represent like this way in your exam, you will get full marks. This is the easiest way to understand how these drugs work, because if you understand where are these receptors present and which stimulate the HCl secretion, we can use the drugs to block that receptor, and we can know the drugs easily and we can remember very easily. That's all for today. Thank you.